During the annual Uganda Protestant Medical Bureau Symposium, Executive Director of the Medical Bureau, Dr. Tonny Tumwesigye, called on the government to collaborate with private health facilities to improve health services in Uganda, especially addressing the burden of non-communicable diseases that is on increase in the country.
UPMB is one of the players under the category of the private not-for-profit. But as we know, the health sector has other players. We have the public sector, but also have the private for-profit sector. And we also know that there is also the complementary medicine. So one aspect that we thank government and continue to urge government is the collaborative aspect, and we commend government for this, bringing together all the other players so that we are all contributing to the health services of our country. So that is a pivotal role that we commend government and continue to request government to take lead on.
Dr. Tumwesigye says that many Ugandans in rural areas get challenges in accessing health services due to limited resources, hence calling upon the government to advance resources to private health facilities to be able to offer free services to some Ugandans that cannot afford the payments, as well as advancing resources to joint medical stores for the facilities to be able to order medicines from JMS.
Another area that we commend government on is that we know that government is responsible for the entire health of the population of Uganda. So being the leader there also means not only supporting the public sector, but also considering the other sectors. For instance, we commend government for the support that it gives to our sector through what we call the primary health care conditional grant. So government advances resources to our facilities so that they are able to offer care to those vulnerable communities or people who are not able to pay. The other aspect that government also advances resources to joint medical store, which is our supply chain arm, and so that our facilities are able to order medicines from JMS, and then clients are able to access those medicines through our health facilities.
Dr. Tumwesigye also urged the government to allocate more resources to Ministry of Health to be able to allocate more resources to non-profit health sectors to be able to offer health services in rural areas.
As the resources improve in the government sector, we continue to urge government to allocate more resources to the Ministry of Health so that the Ministry of Health is also able to allocate more resources to the not-for-profit sector, which are over 80% serving the rural marginalized communities of this country.
He revealed some of the key areas that they want to put much emphasis as Uganda Protestant Medical Bureau as they continue to offer health services to Ugandans.
We implement very many programs, and most of these programs are implemented in a vertical manner or parallel to other programs. One key issue that has come out strongly is that there is a need for us to integrate programs so that they are focused on the patient. In other words, in a patient-centered manner. One area that comes out strongly is, for instance, we offer HIV care supported by partners that I've already talked about. And in the HIV care, one issue of integration that has come out strongly is that we need to integrate other services in HIV into HIV care. For instance, non-communicable diseases. The other aspect is, of course, TB and others, malaria and other aspects, so that when a patient comes to a health facility, they are dealt with as the patient and not dealt with based on.
Meanwhile, Dr. Dennis, Technical Officer under Minister of Health, while making his presentation during the symposium, highlighted on how Uganda as a country can address the burden of non-communicable diseases in Uganda.
Point of care testing should be everywhere. I'm happy that when I was entering, I saw one of the point of care testing they are taking BP. It is very important because this one allows early detection so that we start treatment and prevent this. Then patient-centered care. The patient is the most important one here that we need to focus at. Then by learning from successful models like Rwanda, Uganda can tailor its approach to its specific context and achieve optimal results.
He revealed that medicines for non-communicable diseases are very expensive to the extent that the government cannot afford 95 of such medicines. Uganda Protestant Medical Bureau Symposium 2024 was organized under the theme, The Imaging and Integrated, Equitable and Efficient Healthcare Service in Uganda.
However, there are challenges. You cannot do without challenges. Challenges are always there. The system is not perfect. We have always limited resources. I told you already that government cannot afford 95% of NCD medicines. That's why we are going into the health facilities, telling them to form what? Patient clubs. And through these patient clubs, they can gather resources and buy this medicine easily. These only the medicines for NCDs, they are even more than the medicine that can run Ministry of Health, the health system. That's how serious it is.
JULIUS, MUHUMUZA, Church of Uganda Family TV, News at 8.